With age comes wisdom, and for many also comes creaking, swelling, and pain associated with the accumulating years. And osteoarthritis could be to blame. To help us understand why you may be feeling less like Superman and a little more like the Tin Man is Dr. Elliot Rosenstein from the Institute of Rheumatic and Autoimmune Diseases. Welcome, Dr. Rosenstein.
Thank you, Jesse.
So first off, tell me, what is the difference between osteoarthritis and regular types of arthritis that we're more commonly associated with?
Well, osteoarthritis is really the most common type of arthritis. So arthritis is used very loosely. It actually represents probably 120 or more different conditions that can cause joint pain. But the most common one is osteoarthritis. And in the United States, it affects at least 30 million individuals, and the numbers are probably much higher than that.
And what is the difference between osteoarthritis and rheumatoid arthritis?
Right. Rheumatoid arthritis, which we actually talked about here a few weeks ago, is a very different disease. Rheumatoid arthritis is an autoimmune condition where the body's immune system makes a mistake and starts to misidentify our own tissues, in particular our joints, as something foreign, and mounts an inflammatory reaction against the lining of the joint. Osteoarthritis we speak of as a wear and tear type of arthritis, more of a degenerative condition. It's not simply that, but because it happens more as we get older, that's certainly a component of why people develop osteoarthritis.
Okay, so you've heard the old wives' tale. If you crack your knuckles, does that cause osteoarthritis? Is it from that type of wear and tear?
No, it's not from that kind of wear and tear, so I'm guilty of it too.
Me too.
I think many of us, but one does not have to be fearful of generating osteoarthritis in the hands from cracking one's knuckles. But there are other types of wear and tear that can cause damage to the joints. And the way we like to think of osteoarthritis is unusual stress on a normal joint or normal stress on an unusual joint. Something has disturbed that joint, either some mechanical disturbance or some genetic or hereditary predisposition to loss of cartilage.
Mm-hmm. So it could be in your gait, it could be in normal everyday things that you do. Are there things that you can do to prevent it? Supplements, diet, not walking or sitting a certain way?
Well, it's not so much the normal everyday things that we do, but unusual things that we might do. And a good example is baseball catchers.
Okay.
So baseball catchers who are squatting all the time have a tendency to develop osteoarthritis in their knees much more often and much sooner in life than somebody who doesn't use that stance. So for the most part, normal activities will not bring on osteoarthritis unless there's something wrong with the joint to begin with. Mm-hmm. In terms of what we can do to try to prevent it, one of the major things we can do is not gain weight. Obesity is one of the major risk factors for development of osteoarthritis.
Okay. And are there types of supplements that you can use to prevent it?
All right, supplements are very popular, but when one looks at the scientific evidence that supplements have a role in the treatment of osteoarthritis, the data is very scanty. And coming back to what Jackie said on an earlier segment, one really has to be very careful about the information that you hear, where it's coming from, how valid the material is. There are a lot of popular supplements, glucosamine, chondroitin, S-adenosylmethionine, MSM, ginger, turmeric.
Fish oil?
Fish oil.
Right.
Fish oil may have some data supporting its use in rheumatoid arthritis, but in osteoarthritis there isn't good data to show that it's helpful, nor is there good data to show that those other supplements are helpful, yet they're very popular.
So you're telling me there might not be truth in advertising?
There may not be truth in advertising. I think we've heard that often.
All right. Now what about over-the-counter medications, not just supplements, but other products that are out there touting their abilities to help you prevent these side effects?
Well, the key word there is prevent. There's nothing that we know of from a medical point of view. There's no pharmacologic intervention that we know of that will stop osteoarthritis from developing or stop it from progressing once a person has it. There's a lot that we can do to treat the pain.
Mm-hmm.
So
can you go into that?
Certainly. Acetaminophen, what's popularly marketed as Tylenol, is probably the safest analgesic medication, the safest painkiller. And that's generally what we will recommend that people take first. If acetaminophen is not effective, then the non-steroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen, marketed as Advil, and naproxen, marketed as Aleve, they can be helpful, but they have, in general, more side effects associated with them than acetaminophen.
And then if the over-the-counter medications don't work, what about surgery?
Well, before surgery, we generally consider the last resort. There are other prescription medications which are effective for the pain. There are other treatment techniques such as injecting corticosteroids, injecting another material called hyaluronate into the joints, which is helpful for some patients, but not universally. And surgery we will usually recommend only for patients who have failed all conservative measures. But I want to come back to the weight loss and exercise. Those are really the two things that should be emphasized. In terms of treating osteoarthritis, lifestyle measures are more important than the drugs, more important than surgery. Certainly should be concentrated on before anybody considers surgery.
Okay. Is this an inevitable side effect of aging?
If one did x-rays on people over the age of 65, you'd find evidence of it in about 80% of patients. But only 60% of people will complain about it. And there are people who live to be 90 or 100 and they never complain of their osteoarthritis. So will we find it in patients? Yes. Will they necessarily complain of it? No.
All right. Well, thank you very much. It was very insightful. I appreciate you being here.
I thank you.